Hello, everyone, and welcome to today's webinar hosted by the International Society for the Prevention of Child Abuse and Neglect. We thank you for joining us and appreciate all you're doing to help children during these challenging times. We are pleased to present three speakers today from a group called the International Scholars for the Protection of Children During COVID, which was started by one of our speakers, Karmit Katz, in the spring of 2020 in response to the pandemic. This group has been busy in the last year collecting data, developing frameworks, and publishing articles and special issues in child abuse and neglect. Today, our three speakers will discuss what they have learned from the available data about the impact of COVID on child maltreatment reports and the responses of Child Protective Services in three countries with contrasting experiences: Brazil, Israel, and Australia. Excuse me. Right now, I have everyone on mute to avoid background noise. On your Zoom toolbar at the bottom of your screen, you can see Q&A and chat. We welcome you to use the chat to talk with other attendees and with me if needed. Please use the Q&A to type questions for the presenters throughout the training. We ask that you please type your questions when you think of them and not wait until the end. If you have a question for a specific presenter, please type his or her name with the question. Questions will be asked and answered at the end of the presentation as time permits. So now I'd like to introduce our three speakers today. Karmit Katz is an associate professor at the Bob Chappell School of Social Work at Tel Aviv University and the head of research at Haruv Institute. She is the founder of Justice for Preschoolers, an interdisciplinary Israeli team which promotes justice for maltreated children. She's also the founder of the Israeli Public Committee, which changes policies toward child sexual abuse. Professor Ilan Katz is director of the Social Policy Research Center at the University of New South Wales in Sydney, Australia. He has many years of policy practice and research experience in children and family services in the UK, including as head of evaluation, practice development, and research at the National Society for the Prevention of Cruelty to Children. He has led over 120 research projects on a wide range of social policy issues and has a particular interest in child protection system reform. And finally, Sydney Priolo Filho is a clinical psychologist and researcher in Curitiba, Brazil, who specializes in children and families in violent contexts. He is an assistant professor of the University Tuiuti do Parana. Sydney. His current research interests include the impact of intimate partner violence and child abuse on the life cycle and the evaluation and interventions with child protection professionals. Thank you, Karmit, Ilan, and Sydney for being with us today. Now I'll turn it over to Karmit to begin.
Thank you, dear Heather. I will just share my screen with you all. So good morning, good afternoon, good evening to all our dear colleagues and community worldwide. I'm very happy to be here today together with my very good colleagues and friends, Ilan and Sydney, in order to talk to you about 1 year into the pandemic and the impact on child maltreatment reports and child protective services responses. The three of us, as Heather just said, are part of the international group of scholars protecting children from maltreatment during COVID-19. And we are very happy to be working together and to try to advance and promote both evidence-based and empirical studies in order to protect children, but also to promote policy and practice worldwide. In our first framework, we developed a suggested framework for the way the child maltreatment can be approached and can be seen during COVID-19. And we want to start with this framework because we think it can really help us to capture today's presentation. And in this framework, we saw that there are basically 3 central levels in the ecological framework of children and families that can really help us understand what happened to child maltreatment during COVID-19. The first one is the individual and interpersonal interaction, and we spotlight specifically about the impact of COVID-19 on the well-being, attachment, and access to basic items for children worldwide, as well as its impact on the education. We also discussed about the parents and the extended family, the school closure, and the internet use. And within the second level of the suggested framework, we're pinpoint the neighborhood and communities, and more specifically, the impact on COVID-19 and the shutdown on all the formal services, on the impact on the family and the services they were provided with, as well as the increased rates of unemployment, poverty, and financial difficulties worldwide. And last but not least, the third level is the societal and cultural context in which we spotlight policy issue, poverty and racism worldwide, with specifically relevant to the increase of child maltreatment. And today we want to talk to you about our project, which was designed in order to explore the impact of the pandemic on child maltreatment reports and on the child protective services responses by comparison all our involved countries using available population data. Our first wave, which was taken in May 2020, was already published in Child Abuse and Neglect. And today, we will update our findings to 1 year into the pandemic, and we will specifically spotlight 3 countries, Australia, Brazil, and Israel. And we thought that the comparison of our countries is really relevant because of the various contexts of our countries with COVID-19, with Brazil being tragically impacted by COVID-19. In this comparison to Australia, we're able to mitigate the virus, and to Israel, who were able to disseminate a lot of vaccination. So by this introduction, now as Ilan will talk to us, Sydney will talk to us about what happened in Brazil. Then Ilan will discuss about Australia. And then I will come back and talk to you about Israel. So, Sydney.
Good morning, everyone. Thank you, Kermit. We're going to start talking about Brazil and this tragic events that been following through the pandemic. I chose this photo because it's a really strong picture of what is happening in the country. This is a graveyard in the city of São Paulo. This was on the New York Times, and the country today has a mean number of deaths that is 2,000 deaths plus per day. And we can see that in the number of cases, those are, one back. Yeah, thank you, Carmen. Those are the daily new confirmed COVID cases. As everyone can see, Brazil always, since the beginning of the pandemic, had more cases per day compared to Israel and compared to Australia. So we have a pretty continuous movement, and we can see that in the cumulative deaths as well. So in this slide, we can see that the cumulative deaths in Australia and Israel was always kept in a really low rate, while in Brazil, we had a strong increase in those rates. So what we see here is a really unique situation that unfortunately is happening in India at the same moment. And as we can see, the virus rampage through the country. In the next slide, we're going to see a little bit about the child abuse reports during the pandemic. Brazil has a centralized reporting system that is called Call 100. 100 is the number that you call to make reports of suspicious or substantiated child maltreatment. And what we saw when the service was first created in 2013, we saw a huge number of cases being reported with a certain stabilization, with a stabilization on the after years of that. But last year, we had an increase in those numbers. We had 95,000 reports of child abuse. This doesn't mean that those are all substantiated cases, and it doesn't mean that they are from different children. The same children can have a report from different neighbors, for instance. But this is an indication for us that there's something going on during the pandemic, and those reports and how they're going to be investigated and how those reports are going to be substantiated or not is still pretty unclear. So we had a lot of problems during the pandemic, and maybe the biggest one we face as a society to protect children is the social vulnerabilities that were enhanced by the pandemic. Right now in Brazil, we have 14% of our population that is unemployed. And we have almost 6 million people that are in a situation that the Brazilian Geographic and Statistical projects call it desalento. Those are people who are not even searching for work. They just gave up searching for work and they're trying to scrap by day. Today, we have 27 million people below poverty line. They are making less than $1 per day. And we have almost more than half of the country without food security. So this is a big issue that enhanced those problems that were here, but they were minimized by social policies, they were minimized by the services and the economy. And right now we have a ticking time bomb regarding social vulnerabilities. Another issue that really impacted children here in Brazil were the school closures. 18 states never reopened schools in Brazil from the beginning of the pandemic until today. So we have since March 15 of last year, we have children that are out of schools. Adding that to the economic crisis, we have an increase in dropouts. So we have today, those children that are on the radar, we have 4 million children that are out of school. We also had an increase in child labor, but that data is still being disputed by the government. But we had a continuous decrease in child labor from 2000 to 2019. And at this probable increase in child labor indicates to us that those children with the economic crisis and those school closures, they went to work to help their families. And we have a pretty unequal response in Brazil as well. So we have private education that is following safety measures and those children are back in schools. And we have public education that is pretty much closed down across the country. Professors were not vaccinated in the country until now, so those professors didn't return to the classroom. When we talk about another kind of variables that are important to protect Brazilian children, we have some guidelines from some professional associations. And one aspect that really catches our eye is the family interaction. Brazilians usually have extended families and attachments, and we have those extended networks of protection. And with the pandemic and quarantine and social isolation measures, those family interactions were really affected. And probably grandmothers, aunts, uncles that protect those children are not having access to those children, are not in touch with those children. So we do not know how those aspects might impact child protection in our country. Another aspect that really catches our eye is that Brazilians really follow routines. So it's schools, then they have soccer in the afternoon. We have like this pre-established routine in our children's lives. And we do not have that anymore. A lot of children do not have access to those routines, to those social clubs, and all those other activities that were provided by schools or other organizations. Also, the economic crisis indicates to us that a lot of children are not following those online classes. Since we do not have access, since a lot of families do not have access to food, internet access becomes secondary to that. So we have a lot of children that are not really are not following or having access to schools in this online method. So one of the main recommendations that we have is we need services reopening for children as soon as possible, vaccinating those professionals so they can be back at the real world. In this next slide, we can see how our ecological model that Carmen talked about it, how all those red balloons that we have with the arrows are being affected in Brazil at this right now. So we have a lot of different problems in our country that our model can help us explain why things are looking so bad and how things are kind of in a disarray for child protection. And at the same time, what can we do and what are the silver linings in this situation? So Brazil has a pretty good, solid history of vaccination. And in 2009, during the H1N1 pandemic, Brazil applied 88 million shots in 3 months. Brazilians has one of the higher vaccination rates in the world. But to do that, to actually engage in that would provide us the opportunity to reopen schools, not just for child educational purposes, but for child safety as well. So schools in Brazil are the main responsibles for child abuse reports in the call 100. With school closures, we still had an increase last year, so we might probably have an avalanche of new cases in those services. So it's something that we might have to be prepared for when schools reopen. And those education professionals, they are considered one of the main protective agents in our country. So schools have a larger role, especially in vulnerable communities, than just educational purposes. They give a meaning to that community. They give a sense of community in those areas. And finally, we have some silver linings here in our country. When we think about Brazilian organization, and we're going to see some of the logos in the next slide, we can see that Brazilians they rely a lot in this moment in science. 89% of Brazilians want to be vaccinated according to the last public polls. 89% also indicates that science needs more funding. 88% believe that science can make everyone's lives better. We believe that this is due to a robust universal healthcare system and a social welfare system that provides this continuous tracking and continuous updates to the population and gave a solid response despite all the problems that we had during COVID. So the Brazilian public health system is responsible for providing vaccines and providing care for most of our population. And this seems to be something that really showed its value for our population at this moment. The vaccination intent that was measured in this public poll is the highest in the world. So Brazilians want to be vaccinated, we just don't have vaccines. Without vaccines, we can reopen schools because we have a lot of professors that are older or have comorbidities, and we have a lot of issues regarding that. Without reopening schools, we cannot protect children with the schools in the school setting. Also, those parents cannot go back to work because they cannot leave their children unattended at home. So we have this economic crisis that is followed by that. So we have this really chain link that is showing off a lot of issues regarding child protection in our country. Now I'm going to call Ilan. So Ilan will talk about Australia.
Thank you, Sydney. So Australia, as Kamit said, Australia does provide a contrast to Brazil. Sorry, I'm just starting my video. Okay, next slide, please, Kamit. So in Australia, there was like most countries, there was a national lockdown from March 2020 to May. So it lasted around 6 to 8 weeks. Different states in Australia had slightly different lockdowns. Schools, restaurants, all stores were shut, cinemas were closed, travel was very highly restricted, and there was a total international ban on travel. So Australians couldn't leave the country, couldn't leave the state, in fact, and still can't leave Australia without permission. Everybody coming into the country had to go into hotel quarantine for 2 weeks, and that's still the case today. They quickly started extensive COVID testing, so many thousands of people were tested every day, and instituted a track and tracing program to track people, the contacts of people with COVID-19. By May 2020, Australia started opening out, and schools reopened in May and June last year. Cinemas started opening out, and other activities. People were allowed out to restaurants, etc., from May, June last year. Victoria, one of the states in Australia, did lock down again from July to October, but the rest of the country slowly emerged from lockdown from May 2020. And then there have been kind of mini lockdowns in various parts of the country since then. The restrictions on travel, though, has remained and is still in place. Okay, next slide. On the other side of the coin, in terms of the response, there was significant temporary government support for businesses and employees. There were two programs called JobKeeper and JobSeeker. JobKeeper went to employers to keep businesses going, and JobSeeker went to employees, people who could no longer work, and so were given temporary assistance by the government. That lasted until around October. Childcare was free, particularly for priority workers, even during the lockdown. There were subsidies for telehealth, and mental health was increased, so people had increased access to mental health and to health, and homeless people were temporarily housed in hotels to prevent the spread of COVID-19. But then on the other side of the coin, in this year, there have been very long delays in the rollout of vaccination, and Australia is very far behind places like Brazil and Israel in terms of vaccination. But still, the level of COVID-19 is still very low in Australia. Today, there was one case in New South Wales, for example. Having said all of that, many of the risk factors for child safeguarding and child abuse were apparent even in that situation. So domestic and family violence agencies reported very high rates of report, particularly the NGOs dealing with domestic violence. Mental health reports and referrals to mental health services grew considerably during 2020. There were reports by the police of very high rates of online grooming and abuse of children online. And that's because children were spending much more time online than previously. Alcohol consumption rose, and that's a risk factor for both child abuse and domestic violence. But these risk factors were distributed unevenly across the population, and it's a similar pattern, I think, to Brazil, and we'll find in most countries. So, for example, migrants, foreign students, casual workers were most heavily impacted and couldn't access the government supports that the general population could access. Some vulnerable people benefited from those increased subsidies. So some of the poorest people actually their lives improved in that sense, but others didn't have access and were even much worse off. Interestingly, in Australia, Aboriginal and Torres Strait Islander communities, Indigenous communities, did protect themselves effectively. They were in the highest risk category, but actually mobilized themselves very effectively to protect themselves from COVID-19. but not from the effects of lockdown, though. So what happened with the child protection system? So I'm going to talk specifically more about New South Wales, which is the state that I'm in. Each state had a slightly different response. In New South Wales, most child protection work changed to remote working where possible, but face-to-face investigation continued where necessary. One of the biggest impacts, though, was that support services, so although the statutory services continued, support services mostly moved online, and many of them actually stopped for several months during the pandemic. So a lot of the services supporting families and supporting vulnerable families either didn't operate at all or went online. And of course, people who have poor internet access or not good access to computers were not able to access those services. Workers were quickly trained, so there was a lot of training going on. For example, to use PPE, personal protective equipment, and to do their work online. And there was internal guidance produced for workers, and then online guidance for carers, reporters, and other people involved in child protection and out-of-home care. And I've got a link in the slide to that guidance. One particular issue was that for children in out-of-home care, face-to-face visits with birth parents went online. And this is anecdotal information that had both positive and negative consequences. Some children actually valued that and felt actually safer that they didn't have to have face-to-face contact in a contact center with their parents, but could actually interact with their parents online. Other children, it affected very badly, and they desperately wanted physical contact with their families and couldn't have it. Many of those birth parents had to be trained to use Zoom or other mechanisms. So sorry, carrying on back to that. Yeah, so the next slide shows you the child protection notifications and children in out-of-home care in two of these states, New South Wales and Victoria. And you'll see that during the lockdown, there was a significant decline, particularly in both states actually, during the first lockdown of reports to child protection. In New South Wales, those quickly went back to the longer term trend after the lockdown. Victoria, as we said, had a much longer lockdown period, had initial drop in reports, and then as the lockdown carried on, reports went back to the previous trends. In terms of children in out-of-home care, they remain more or less the same over the whole period. Yeah, okay, next slide. So in summary, there was a drop-off in both New South Wales in the first lockdown period, mainly reports from schools. So one of the lessons was how important schools are in the context of child protection. And I think that's an international lesson that we all learned. Reports reverted to the normal pattern and stayed the same during the second lockdown phase in Victoria. So the system adapted to the lockdown pretty well. Reports of exposure to domestic violence did not go up substantially. So although the NGOs reported much higher caseloads, the reports to the child protection system didn't go up substantially during this period. And other potential indications of risk have also not yet eventuated. So there was a predicted tsunami of youth suicide, and yet the statistics so far haven't borne that out. One of the issues, though, is that the return to normality after the lockdown seems to have been as stressful for some as the lockdown itself. And so a lot of these factors which we expected during the lockdown are beginning to manifest themselves after the lockdown has ended and we've gone back to what's so-called normality. Okay, I think it's over to Karmit now to talk about Israel.
So when we're spotlighting Israel during COVID-19, we thought that it's important to pinpoint three really relevant contexts. The first one is, as we talked before, about that although we had in Israel 3 significant waves of COVID-19, the vaccinations came quite early, and now we can really say that we mitigated COVID-19. But parallel to this COVID-19, in Israel, we had the forced elections in 2 years. So during COVID-19, we had 2 elections, which meaning that we're living in stability in the political context, and that many budgets of the educational and the welfare system are frozen and are not available to the population. Parallel to this, it is really important to emphasize on the 3 contexts. The third context in which, because of the political instability, there is protest movement in Israel, which means who's trying to change the policy and the political climate in Israel. So looking on this context, we understand that the impact of COVID-19 in Israel was specifically towards 4 main issues. One is the poverty rates increase, especially among 2 specific population communities in Israel, the ultra-Orthodox and the Arab communities. Along with that is the increase in unemployment. We saw significant increase in mental health issues and a significant increase in racism through all the country, but again, specifically targeted towards ultra-Orthodox community and the Arab community in Israel, as well, and parallel to this, with increased and dramatic increase rates in community violence, especially in the Arab community in Israel. And if you remember, we started with the ecological framework of our group, and it's really important to look on those specific contexts of COVID-19 as really significant and really impact the life of the children in Israel. More specifically, children in Israel during COVID-19, our statistics show us several important findings. The first one is that we're seeing increased stress and referrals to mental health services of children, specifically on eating disorder, anxiety, and sleeping disorder. This is relevant, and I'm not talking right now about children in risk. I'm talking right now about statistics on the population of children in Israel. We also seeing parents reporting that almost a third of the children in Israel did not participate in online classes, although having access to both computers and online. But also, over half of the children in the Arab-speaking schools and more than 30 children in the Hebrew-speaking school did not have computer available for remote learning. And also, 30% of the children from Hebrew-speaking schools and nearly 60% of the students in Arab communities did not have stable internet connection, which prevented by them the most basic right for education. Out of more than 100,000 calls for counselors from psychological and educational services, the most frequent complaint concerned children were their feeling of loneliness, educational difficulties, anxiety, emotional distress, and family difficulties. Also, our National Council for Suicide Prevention reported an increase of 24% in the number of risk assessment for a teenager during the time of COVID-19. When we want to further spotlight child maltreatment in the time of COVID-19, it's important to look on three main findings. The first one, that in the months of March to October, the number of calls to our government helpline concerning violence toward minors doubled in comparison to the same months in 2019. But it's really important for me to emphasize something at this point. As I said before, in Israel, we had 3 waves of COVID-19. In the first wave, we were shocked, as well as the Child Protective Services, and all the awareness and thinking about children were really missing from the public gaze and from policymakers as well. But following advocates' active acts about the protection of children from maltreatment, we went through campaign in the media, which really helped us to increase the awareness of people to the protection of children towards from maltreatment. And that's really helped us to further look and to see children in the second and third wave. So saying that, along the rise in the call for this national helpline, we saw a significant decrease in referrals regarding neglect and referrals regarding sexual abuse, meaning that the significant increase was with respect to 2 issues that were worried about child maltreatment. One is children physical abuse, and the second was children who are exposed to domestic violence. And also I wanted to say that we saw the dramatic decrease in referrals was from the educational system, but we had more referrals from neighbors, meaning that given that Israel is really small country and our campaign was towards the public and the residents, and we tried to talk to them about how important and how their responsibility in seeing children, because all the formal systems are shut down. So we really got more referrals from residents and neighbors than formal systems. Adding about child maltreatment in Israel during COVID-19, we saw a decrease in the number of minors who were identified by healthcare system and also by hospital. But again, we saw an increase in the number of reports made to another national hotline that we have in Israel. This is the National Call Center for Child Protection in Cyberspace. And the increase was more than 30% compared to the same months in 2019. And we also saw an increase in the referrals to this hotline by minors. From March to October 2020, there was an increase of 24% in the number of minors who were treated in centers of sexual abuse compared to 2019. And how I can explain it, because I just told you that we saw a decrease in the reports on child sexual abuse. So how we can explain that actually there was increase in treatment on child sexual abuse? So this is quite really interesting explanation. And it goes like this. So what we saw, that new referrals about child sexual abuse were in decrease, but actually when child sexual abuse was outside of the family, children used the lockdowns and staying home with their family to disclosure of child sexual abuse that they were not disclosed before. And we saw that in families that the lockdowns had some positive impact on the family dynamic, on the communication between the children and their parents. Children were able to disclose child sexual abuse that happened before the pandemic, and then they were able to provide with services, support, and therapeutic context during the pandemic. So now we will go to Sydney, that will help us to go into the discussion.
So what have we learned so far in this international group of researchers and comparing those countries? And how can we try to answer some of those questions? So in this next slide, we start to trying to put those into words. So we have a significant increase in risk contexts for children, and there's a lot of data indicating an increase in domestic violence, parental stress. Child abuse and neglect has a great paper by Professor Samantha Brown regarding parental stress during the pandemic. How the economic burden across the globe actually affected children, and how those cyber risks, because children are spending a lot of time online, those who can, and how those risks are being evaluated, and how those governments are trying to act to protect children. And across the globe, we also saw a decrease in child maltreatment reports, but those data are not really consolidated yet. So this is something that we might want to wait and see. On the next slide, we try to put some ideas. So those countries that have centralized child protection systems might want to have a unified response across those provinces or states, because this would help those professionals to provide some answers and try to follow some guidelines to protect children. It seems that some states focused all their efforts and funding to COVID and let child protection slip away during the pandemic. So we need to have a focus on child protection and how we can do a better job into that. It seems the economic relief for families by the governments are a really protective factor for children and their parents, because they can have more access to food in the Brazilian case, or even to other resources as in other countries. And also, we might want to add this service support. So how we can use new technologies and how can we approach those new technologies so we can have a fresh look into child protection. I want to cite here the work by Professor Barbara Fallon and Professor Colin Vezina. You can find those, the work they did in Canada during the pandemic regarding how we can use those technologies to help child protection services. And finally, we have three main topics for future efforts. We might want to see how those frontline practitioners are working and how they are dealing with this whole situation. Which children flew under the radar, so which children were left behind and how we can reach to them. And what kind of gold standards we need for policymakers worldwide? So what game-changing the pandemic created in our world that we need some gold standards, some common sense, some common ground across the globe for child protection? Thank you, everyone. I think this was our presentation. Heather, I think now we have a Q&A, right?
Yes. Thank you so much to all three of you. And Carmet and Ilan, if you'd like to turn your webcams back on for the Q&A, and we can just stop the slides, that would be okay. Great, thank you. Okay, so we have a few questions that have come in. I'm going to start with one from Yo, who I think is in Pennsylvania. This was prompted by Ilan's presentation. She's asking about in-person investigations that you talked about, Ilan. She's asking how were they possible, and as far as calls to the hotline for child maltreatment, were workers engaged in business as usual for the most part and just with PPE? So she's just kind of wondering how that was able to happen. And then maybe along with that, if each of you could speak to the status of remote services now where you are, and if there's been any research on the effects of remote services.
So I'll try and answer the first one. I think it was a number of different approaches were taken. Yes, PPE was worn where possible. I think if possible, for example, children were seen outside, so the worker didn't go literally into the home, but saw the family outside. And as I said, a lot of it was done online, if possible. I think they did do a kind of initial triage, and so workers physically went out and did investigations only in cases where it was considered necessary to physically see the child and the family. And that's how they managed it. The workforce, people were working from home, and I understand that they had a system whereby workers worked 1 week in the office and 1 week at home. So it gave workers the opportunity not to have to do frontline work all the time, but to stagger that frontline face-to-face work.
Okay, thank you.
Yeah, so that's how they managed it.
Okay, Sydney or Karma, do you have anything to add about remote services?
I can add from the Israel perspective that the remote services, so for families and communities that have access to computers and internet. So of course it was easier to provide the parents as well as the children support. And also we saw initiative of our child protective services to better engage with the educational system and to instruct teachers how to better handle and how to better support both parents and children. But saying that, we saw that we have enormous challenge in specific communities in Israel, the Bedouin in the south, Arabs and ultra-Orthodox who doesn't have computers, who do not allow to have computers and internet. And then we really were struggling in how to provide both the parents and the children support. And we can talk about some community initiatives in order to further support parents and families. For example, social workers who went to specific families that they were worried about, but they didn't communicate with them. And then they were leaving them food behind the door, meeting them downstairs with masks, walking around with them in order to find a ways to communicate with them. But saying that, they didn't have any access to families and children who were not recognized by child protective services. And by that, they were not seen and were not approached.
Yeah, here in Brazil, we had a different situation because we did not have a guideline despite being a centralized system. There were different agencies in different states with different response. So we had Maranhão that provided internet for the cell phones of students, and then you have São Paulo that didn't provide anything, not even the online classes. So we had states that went to vaccinate those professionals so they would keep track of children, like Maranhão did it and Ceará did it. And we have states that did not vaccinate any of those child protection practitioners as well. So we have a lot of different answers to this problem in Brazil. And mainly what we have is the lack of in-person tracking of the cases. So many states try to use internet, but if people do not have food security, how they can access the internet? So we have this kind of issue here that we do not have a simple solution to it.
Okay, thank you. So we have a couple of questions coming in about the school context, and you've all kind of mentioned that. Jocelyn is asking, for students learning online in your countries, have there been reports of an increase of educators noticing signs of maltreatment or students disclosing online? And if so, have there been any measures taken to help bring awareness and train school staff around this? I think you've touched on this topic, but if any of you would like to speak to that.
Well, I think that was, in a way, the biggest finding of our international study was a drop-off in reports to child protection systems from schools in virtually every country that we studied. And it was very difficult for children to disclose, I think because of privacy issues very often. And I think this did highlight the need, and some schools in some parts of the world are beginning to do this training, but it certainly highlighted the needs of how to spot problems and issues online, as teachers generally are not trained to do that. And so it's a whole new dimension, I think, for teachers and educational staff. And that's certainly highlighted for us a need. I don't know, Carmit and Sydney, if you want to add to that.
Here in Brazil, we have some training, but the professors had to do it this training without being paid. So they had to sacrifice their mental health and use the free time that the short amount of free time that they had to do those trainings. So I do not believe that a lot of them engage in those kind of things. And professors are really burned out here in Brazil because low pays, a huge workload. So I firmly believe that a lot of them did not engage in those trainings. Actually, we have, because this is such a huge country, we have a lot of regional differences. So what you see is city halls engaging in some good practices. So they use the training period of those professors to engage them in some sort of what are signs and when you report. But a lot of the time what we see here is that those professors had to engage in their free time, so they don't, because they are human beings and they are burned out, and we're in the middle of a pandemic as well. So Jocelyn, I don't see that happening in Brazil or any developing country in Latin America specifically.
Okay.
You know, the question made me think that because I've noticed even amongst my own students at university that there's a much higher rate of mental health problems amongst my students, and we've had no training at our university on how to deal with that or anything like that. So I would imagine that it'd be interesting to know from the audience if you've had any training to deal with your students, and if so, what kind of training you've had.
Yes, thank you. And related to that, there's another question here from Carlos in Brazil. You know, the school situation is different in every country and in different parts of every country. But Sydney, you had mentioned that the Brazil schools closed down completely throughout the pandemic, and he's wondering about the effects of that psychologically, and if opening up schools is worth the risk of contamination to help contain psychological damage. If there's any research on that and what your opinions are.
Until now, what we have is international data showing that with good safety measures and safety protocols, school is quite safe for children and professors. Actually, the most exposed person inside the school is the teacher. So if we have vaccines available, the right path would be to vaccinate those teachers, those professors, use those safety measures that the US, Canada, Australia, and Israel now with the vaccination, use it so we can move those children back to school. And it seems that there's some data from the Brazilian Pediatric Society and the Brazilian Psychology Society indicating an increase in mental health issues regarding children, especially adolescents in Brazil. As we said before, the extended family in Brazil is really important. We have a lot of secondary attachments in our families. And when you cut out all those ties at once, it really dampers the mental health of children and adolescents. So it seems to me that is a cost-benefit situation. We have a huge number of cases. We have the country healthcare system collapsed 1 month ago, but we need to find solutions so we can focus on child protection, because if we keep schools closed until the end of the pandemic, so it's going to be 1 or 2 years, so the whole world is vaccinated and we're back on track as we were before. And I don't think that is something that the adolescents and children can take it on their mental health is so hard for them to stay away from school. And it's interesting because it really makes our inequality, our social inequality, be right in front of our eyes. You know, the private sector is back on schools across the country, and the public schools are not open. So I think there's two main problems with that. We have to look at the mental health of our children, and we have to look at those social inequalities that are highlighted at those moments.
Great, thank you. We don't have a lot of time left, so I would like to end with this kind of more general question. The current work of the International Scholars Group or other work that you see going on, is there an engagement in policy practices based on current findings? And related to that, if any of you would like to speak to, you know, you discussed the plans and research that you're planning to do, but any recommendations for future research, or if you see you know, recommendations coming out about future crises, how we can respond to future crises. I know that's a big, just kind of the big picture view.
Yes, but it's definitely right on point for our group. I think like our group mission, we gather together to do good research, but also we see in ourselves, each one of us, as advocates in our own countries, but also in the international levels. So we're really committed to develop a grounded in data and quality research, but also based on that, to promote the policy practice, both in our countries, but also in the international level. And I must say that the exchange and the discussion in our group are so fascinating and so inspiring. So many times we're really giving ideas and directions to one another, how we can promote services and policy practice in our own countries. I can say that for me in Israel, it was so dramatically helpful to understand that in other countries, policies were targeted to the protection of children, resources were allocated. It really gave me power in order to change something in Israel. But also in the same level, now one of our main projects is to gather together steps towards the way in which children can be protected, not only during COVID-19, but also during global crises. And we really want to think about the way, not only the downsides of COVID-19, which is dramatic and tremendous impact in all many domains to our society, but also what can we learn from COVID-19 on the way child protective services can perform better in order to protect children. And as Ilan and Sydney elaborated before, one of our main conclusions is the importance and central role of school have in the protection of children, and how we cannot really protect children only putting all our efforts in the welfare. So we really need to better connect between those two systems. But this is just the beginning of this, and I'm sure that Ilan and Sydney can elaborate more on this project.
Yeah, no, I totally agree with Carmen that those different experiences, and I think those three countries that we discussed it here, we have dramatic different experience regarding COVID here. So we have a vaccination success at the case of Israel, we have a COVID control in the case of Australia, and we have no control and no rules, and COVID does whatever it wants in the Brazilian reality. So I think those impacts will be short and long term, because we have a lot of children in Brazil that lost their parents, lost their grandfathers. So we have a lot of long-term issues that we have to find some common grounds in other countries with other research, so we can actually find out how can we help in the sense that to provide better service, more comprehensive service, more prevention. That is a topic that is really underdeveloped in developing countries, and using this word puzzle. So we really have to try to understand, especially in developing countries. I'm talking a lot of my perspective as a Latin American resident. So in Latin America, we have a lot of those social inequalities that they were really highlighted by the pandemic. But those things happen in Israel, those things happen in the US, in Canada, in a lot of different countries. So I think the main strong suit of our group is that we can learn from each other, and we can try to provide those answers, but we cannot try to provide them alone. So we have to work with those agencies, we have to work with the professionals so we can try to find that solution.
Great, thank you. Ilan, do you have a few words?
Yeah, just very briefly, I think the two biggest lessons we've learned, just reflecting my colleagues, firstly is that child protection isn't just about child protection systems. It involves education, health, social protection, employment, and all these other systems. So to protect children, we need to engage in all those systems. That's the first big lesson, and how we do that is, I think, a key issue for all of us. The second one is the online situation, which every country has experience of children moving online. Yes, that was increased, and obviously it's a feature of the pandemic, but increasingly children are online, even without the pandemic. And so we have to learn better techniques of protecting children online, identifying children at risk online, and using the internet more effectively to protect children. To me, those are the two biggest lessons from our work so far.
Wonderful. Okay, that's a good note to end on. Thank you so much. So I'd like to thank all the speakers again, and to everyone in the audience for joining us today. If we did not get to your question, I will make sure to pass it on to the presenters, and we will do our best to get your questions answered. So to wrap up today, I would just like to encourage everyone to become a member of ISPCAN if you're not already, so that we can continue having webinars and trainings in the future. Our member benefits include a subscription to our monthly research journal, access to our past webinars and other educational resources, the ISPCAN child abuse screening tools, and discounts to all of our congresses and trainings. We offer several membership levels, including our associate membership at $35 a year. And I'd also like to invite you to visit ISPCAN.org to learn more about our upcoming and on-demand webinars and trainings, including 2 new on-demand trainings. One is a 4-part series on a multidisciplinary approach to abusive head trauma, and the other is a brand new 4-part training on child maltreatment data collection. To learn more about these trainings, you can visit us at ISPCAN.org. And finally, I would just like to remind you that a recording of this webinar and a PDF version of the slides will be available on our website shortly at ISPCAN.org. And if you have any comments or questions about this webinar or any of our webinars or trainings, please contact me at resources@ISPCAN.org. Thank you all again for joining us today. We hope you stay safe and have a good day or night, depending on where you are. Thank you again, Carmen, Ilan, and Sydney. All right, take care, everyone. Bye-bye.